My name is Henderson Cole. I have just had a treatment over a period of time for swollen feet and legs, and it has succeeded in getting them down. And I'm now in the process of getting elastic stockings to keep them in shape. A number of years ago, my right foot began to swell, and I was told it was water retention, and I was given some diuretics. It didn't seem to do much good, and then my left foot began to swell. This was some years ago, and finally the legs began to swell, and the ankles became almost invisible. During this time, I tried several sessions of diuretics and keeping my legs up and exercising, walking a lot. Nothing really seemed to do permanently any good, although there was temporary reduction of the swelling. And finally, someone suggested that maybe it was more than just water retention, and it was recommended that I visit this organization who had a technique for reducing the swelling. I was introduced to the name Lymphedema, and it was explained to me that I had a return circulation system as well as a blood circulation system.
Lymphedema. Often how I describe it to patients in a simple way is that it is chronic swelling. So it is swelling that's not going away. But the term lymphedema does mean that there is a problem in the lymph system causing fluid to back up into the lymph. So that is the reason the swelling doesn't go away. The term lymphedema doesn't explain cause, but it does say that other than that there's a problem in the lymph system.
And that this was not removing all of the debris in the water in the return system, the lymph system, and that this debris was accumulating in the tissue. And that they had a physical technique for reducing it by forcing it out, which I agreed to do. And it's a very interesting technique. They basically put you into a big a spacesuit kind of thing. In my case, it was just the legs, and introduce pressure. They call it a pump, but it's just a pressure system that slowly works from the bottom up your leg and forcing the lymph system to transport the material up, where it supposedly gets processed in the upper body and gets back into the bloodstream and then into the kidneys and out. There was several months of coming in. Well, first of all, there was just a concentrated period of coming in every day for the pumping. And then after that, there was coming in 2 or 3 times a week, where they had wrapped the leg so they would not return to the original condition. And after that, they ordered some of these elastic stockings to, I guess I have to wear them the rest of my life to maintain the now sort of proper shape and size of my feet and leg, proper shape. Initially, when it all started, and that would have been quite a few years ago, the feet would swell to the point that it was actually painful, in the sense that the skin was stretched very, very tight. And that in itself was a painful condition. Sometimes it would fade away a bit and relax, and most of the time it did that. But occasionally, through the years, I could almost feel them swelling, and first one foot and then the other foot. It wasn't always both feet.
The main symptom that you see is swelling, and they can start very subtly so that you don't maybe even see it unless you measure the volume or circumference and compare. If it's in an arm, for example, you can compare the right arm to the left arm, and you can see that one arm is bigger, so we know it's swollen. But then lymphedema, having the swelling can cause many other problems. So it can cause pain if a nerve is being pinched or the skin is being stretched. It can cause skin problems. It can cause sores, blisters, something called weeping. That's where fluid is being pushed through the skin, so it sort of looks like the skin is weeping. Those are the more common problems, and it can also cause, it increases the risk for cellulitis, which is an infection of the skin. So many of the patients that suffer with lymphedema also suffer many of these other secondary things, and often even have to go to the hospital to get antibiotics for infections.
Since the condition has now disappeared, I do find it a little bit easier to walk. And my family and friends are much more pleased to see that I don't have elephant legs. And I'm very, very pleased with the outcome. And they've been very generous with their time and technique. I certainly feel more comfortable with my feet and legs in that.
I do think that it is good to increase the awareness of lymphedema, because I think it often goes undiagnosed and untreated. So the more people that are aware of this condition and that there is a way to manage it. As of today, there is not a cure for lymphedema. There's no surgery or medicine that works on it, but it is very manageable. And the sooner we can work with it, the easier it is to manage.